Hi, this is Dr. John Martin, and this video will be on hormones. Doctor. When I first started to think about this video, I'm like, oh my gosh, do I really want to take on this hormonal issue? But I do, and I think a lot of women go through struggles as they grow older about what to do with their hormones. I even think there's kind of a whole cottage industry made up of physicians, OBGYNs, internal medicine doctors, family practice doctors, homeopathic doctors, all of these people who kind of are trying to tell women, hey, I'm there for you, but they make an industry of it. So I'm a little leery of it because it's a money generator for them. I see advertisements of, hey, are you tired? Are you feeling emotional? I can help you. And they kind of pull you in. They order lots of tests on you. They try all these things. And I just feel it's deceptive. So I'm going to give you kind of my take on that. First of all, I never use the term perimenopausal or premenopausal. And I don't like that term because, and even other physicians use that term, people I respect and admire. But for me, as soon as you say peri or premenopausal, women drop that peri or pre and they think they're menopausal, no matter what age they are and what they're experiencing hormonally. And so I think that scares them. The other thing I don't like about it, it implies there's a science behind it. Like I can look at a certain lab and blood level and say, hey, look, hang in there, and within 5 months or 2 years, you're going to be menopausal. It doesn't really work that way. Hormones change not only on a daily basis, but really an hourly basis. If you don't believe me, look at your hormone test sometime and look at the variation of the lab. It'll go from like 3 to 300 on estrogen levels and like 1.5 to 200 or 100 on progesterone levels, all of these different things. And that's just because of that variation. So I always tell patients, they're my lab. How they're feeling, what they're going through is what I try to react to. Now, it is important that you understand what menopause is. Menopause is the cessation of your periods, and also that your body is hormonally changing, and you will not have very high levels of estrogen, and you will feel that you don't have those high levels of estrogen. The average age of menopause is 51. So what you have to remember is for every 41-year-old who goes through menopause, there's a 61-year-old who goes through menopause. It's very hard to predict. Again, like I said, there's no blood test, there's no blood level. In fact, there's only one blood test that really diagnoses menopause, and that's called the FSH. Every lab has a little bit of different variation of what the level is of menopause, but that test is either you are or you aren't. And so it doesn't say, oh, you're in our lab, 23 and higher is menopausal. So if you're 21, it doesn't mean, hey, you're going to go through menopause 6 months from now. It just means you're not. So if it's above 23, you are. And if it's less than 23, you are not. So that's an important thing to remember. Again, I think there's people who exploit how you're feeling hormonally. What I always tell women, they intuitively know that their hormones are different than 20 years ago or 30 years ago when they were young. Women sense that change all of their lives. But there is a point, and this is where the terms perimenopause and premenopause come in, where you start to get menopausal symptoms. Hot flashes, mood swings, vaginal dryness, changes in libido, changes in your period if you're still getting period, sleep pattern changes, disturbances, if you will. All of that can occur, and those are menopausal symptoms. But that's why there's this confusion. You're not menopausal, but your body is hormonally changed. So I like to say your body is hormonally transitioning, or you're going through hormonal fluctuations that give you those menopausal type symptoms, but you are not in menopause. There's even a more complicated group of women who, like, one time you'll do a blood test and it'll show they're menopausal, but then they'll have bleeding, which you should never bleed. Once we diagnose you as menopausal, you should never bleed again. But what'll happen to that group of women, they'll start bleeding, and I'll do their blood level 3 months later and it'll show they're not menopausal. So I always say there's two types of women. There's ones who quietly go through menopause, their periods stop, they don't really experience a lot of symptoms, and they just go through the transition. And they're like, oh, I don't know what this big deal is, menopause. Everyone's got a friend who does that. But the second type of women, their bodies go kind of kicking and screaming. They'll start bleeding irregularly. They'll start getting the hormonal or menopausal symptoms that will really change for them. And there's a lot of women who experience that. Whatever you experience is really what you're allowed to experience. For me, I break it down into once you start getting those symptoms, if you're not having periods on a regular basis, I will test to see if you're menopausal. Do that follicle stimulating hormone or FSH. If they're still having regular periods and they're having the symptoms, I just tell them this is a hormonal fluctuation and a hormonal disturbance that they're going through. I will give them options for it. You can go on a low-dose birth control pill. When you're over the age of 35 and you're a non-smoker with no history of deep vein thrombosis or high blood pressure, you can be on low-dose birth control pills until you transition through to menopause. If they are menopausal, then I'll give you them the option of treatment. And the treatment most commonly is hormone replacement therapy. It is important to have that discussion with your doctor about hormone replacement therapy because there's a study 10 to 15 years ago called the Women's Health Initiative, which showed when you're on estrogen and progesterone for longer than 5 years, there is an increased risk of breast cancer. It's not a huge increased risk, but it's still an increased risk. And that's a private discussion between you and your physician. I will tell you some women elect to not go on hormones, whether it be the low-dose birth control pills or the hormone replacement. And there's still some medicines we can give to help with vaginal dryness, with changes in libido, hot flashes and mood swings, all of that. So there should be some discussion with your physician on that as well. So key points to remember: don't let somebody take advantage of you ordering lots of different tests. Make sure, are you menopausal or you're not? So do that FSH test. I always throw in an estrogen level on patients who I feel want to see what their estrogen levels are, but 90% of the time, if they're not menopausal, they're within that very broad normal range. Then decide what you want to do. If you're menopausal, do you want to go on hormone replacement therapy? If you're not menopausal, do you want to go on the low-dose birth control pills as long as you don't have those risk factors of deep vein thrombosis, high blood pressure, and smoking over the age of 35. I hope this video was helpful for you. If it is, like it, share it, follow me on Instagram or Facebook. Be safe, be kind, and be well. And thank you very much, and have a great day.
Doctor, doctor, you gotta help me, please.